So another point is safe burial for Lassa fever cases. There's a major risk of transmission when a patient dies of Lassa fever, as the dead body remain contagious for several days after death. So this point is very important. If somebody dies from Lassa fever, that dead body remain contagious for several days after death. You know. So if you have a loved one who dies, who was very sick, dies at home, dies in the hospital, you know, if there's suspicion of Lassa fever, you should note that the dead body can serve as a source of transmission of of the disease. The family and members of the community are also at risk if the burial rites involve manipulation and cleaning of the body. Those who do the washing and cleaning of the body, if the person has Lassa fever, these persons can get the disease in that process. The body and immediate environment of the disease are likely to be heavily contaminated with the Lassa virus, and therefore scrupulous attention to appropriate PPE, that's personal protective equipment, and cleaning procedure is required. Attention and care must be taken to avoid injuries in or around the body. um You are helping to prepare. There are process. Patient dies from Lassa fever just like patient die from Ebola. you know there are processes, there are ways in which the body should be handled. you know so that should be borne in mind. And if you are tasked with helping to move the body, you should put on personal protective equipment. As you saw with the burial of patients that had Ebola, you see the personal protective equipment that those who were carrying the body wore. So you should take note of that. So we'll talk now about Lassa fever in children and in pregnancy. This one is a study that was done by Shad Shad Hari et al. Is in India, and a host of people from other countries. They did a study on the titled Burden of Lassa fever disease in pregnant women and children and options for prevention. It was published 1st January 2025. So it will help us talk about the Lassa fever in pregnancy and in children. So I read parts of the study. Although there are distinct peaks at the beginning, okay, so there are distinct peaks, okay, sorry, let me take that again. Although there are distinct peaks at the beginning and the end of the dry season, January to March, cases can occur all year round. And the peak of Lassa fever usually during dry season from January to March, which is the period we are in now. It can occur all year round, but is more common during this period. While Lassa fever can affect people of all ages, children and pregnant women are particularly at high risk of adverse outcomes and mortality. um Children, when they get Lassa fever, is more deadly in children, especially younger children, and it's more deadly in pregnant women, so that should be borne in mind. So talking about ribavirin, ribavirin is a guanosine nucleoside analog with broad antiviral activity, being widely used off-label for the management of Lassa fever. However, due to the limited evidence available from randomized controlled clinical trials, its efficacy remains uncertain, particularly in the treatment of mild Lassa fever. Treatment with ribavirin has been reported to reduce viral titer and mortality in patients when initiated within 6 days after onset of symptoms. So when symptoms start, the drug should be administered as soon as possible, especially within 6 days, to improve chance of a good outcome. So Lassa fever in children, common symptoms in children include fever, vomiting, abdominal pain, pain in the tummy, cough, and headache. Hepatomegaly and splenomegaly, which is enlargements of the liver and the spleen, are also observed in children, frequently observed in children. They could also have bleeding, including conjunctival hemorrhage, bleeding into the eye, hematuria, blood in the urine, hematemesis, vomiting with blood, melena, that's altered blood in the stool, and bleeding from orifices, orifices like the mouth, the nose, the vagina, the anus, and bleeding from puncture sites. So if the person receives an injection, the person can bleed from that injection spot. So these things occur between 10% to 52% of children with Lassa fever report some of these symptoms. One study reported swollen baby syndrome. The swollen baby syndrome is a condition characterized by widespread edema, abdominal distension, and bleeding. So children can have swollen baby syndrome where the whole body is swollen, the abdomen, the tummy is swollen, is distended, and there is bleeding. There can be altered mental status where the patient is not fully conscious or patients can be confused, and things like coma and convulsion could happen. Bleeding, these things, altered mental status such as coma and convulsion, bleeding, and poor urine outputs. That patient is not making enough urine. These things are risk factors for death. So if a patient is in coma, patient is convulsing, patient is bleeding, the child is not making enough urine, these are risk factors that patient with Lassa fever could die. For neonates are children that are from birth to 28 days, less than a month old baby. The clinical features of Lassa fever disease in neonates: there's fever, poor feeding, they will not be sucking or feeding as they used to. Then abnormal bleeding can occur, then convulsions can occur in these small children. What are the sources of infection in neonates, in newborn babies? They can get transplacenta. When they are in the womb, the virus can pass through the placenta and infect the baby. You can get it through breast milk if the mother has Lassa fever and is breastfeeding the child. That breast milk can contain the Lassa virus. Then through direct contact with an infected individual, such as an infected mother. So if the mother is infected and she's having symptoms, the fluids and secretions from her can directly infect that child.